Doc, how you doing again?
I'm good. Yeah.
Nice. So today we have an interesting topic, and we're actually talking about this off air.
Right.
And it seems like one that is deeper than people might expect.
Right.
Because it has to do with weight loss. I mean, when you hear it, go to the gym,
right.
drink water, reduce your eating. These are the regular things we hear.
Yeah.
Are those fair enough to say to someone who wants to lose weight? Go to the gym, drink
healthy,
water,
healthy lifestyle. But we're also looking at somebody who we need to understand how the person gained the weight.
Mm-hmm. Okay.
And weight loss is not for everybody. We are not saying everybody should lose weight.
What?
Yeah, weight loss is not for everybody.
It's which part of
It's a very bad time to hear this because I just started my
what was very like what?
No, to further clarify, in the sense that it's not everybody that you need to lose weight.
Doc, obviously.
Yes. So it's not for everybody, is it? It's not for everybody, is it?
Okay, so that's what you mean.
That's what I'm trying to say.
Okay.
Right. But for those who, yes, because everybody loses weight they have their own reasons. Some is for appearance, some is for health reasons. Because you can use the BMI, basal metabolic rate, the index, to try your weight over your height to find whether you're healthy or obese, overweight, and all that. But today's topic, we are talking about PCOS.
Okay. So before we get to that, I just want to know, is there somebody who is fat who doesn't necessarily need to lose weight because they might be healthy based on appearance?
Yes, somebody can be big, not fat.
Right.
Somebody can be big.
For purpose of...
Yes, so somebody can be big, but
correcting
not...
in society.
Yes, so because when you say fat, we are talking about obesity, that's not healthy. The word obesity...
Okay, so in that context, I am right with that statement.
Yes.
In that context.
Yes, so
but somebody can be big, but that doesn't
naturally
need
big,
to lose
yes.
weight. Okay.
You get it. The person can be like big bone structurally.
I was going to ask if big bone is a thing.
Yeah, it's a thing.
How do you know the difference, please?
You take a lot of history from family. Family, and then you also look at you do something like a lipid profile to find out whether the cholesterol levels, and then you check the weight to a body ratio, fat to body ratio, and all that. Okay,
so we've clarified that.
Yeah.
So not everybody who's big necessarily needs to lose weight.
Yeah.
Now, for those who want to or need to, we're using need to here.
Yeah.
Because want to can be based off your own personal preference, right?
Yes.
I maybe I'm shooting a movie. I want to lose weight to fit in the center. Maybe I have a wedding coming up.
Right. To fit into a suit, yeah.
Exactly. Okay, so this is about need. And today we're looking more specifically at women.
Yes.
Is that fair to say?
Because most people are coming to the hospital with PCOS, and some are also not getting understanding of it. Some are also not noticing it earlier on. For example, we had a patient who came in telling us that she's been getting acne a lot, and then she's realized that she's gaining weight, and it's at the lower part of her belly, and she doesn't understand it. So you have the acne, and then she's growing hair under her chin and on her back. So she's having chest. She's having male pattern hair growth. Now, when we did some tests and we did some ultrasound examinations, we realized that there were just polycystic ovarian cysts, small cysts in her ovaries. What? Right. So my question today was to those listening. You can put your answers in the the comment section, in the sense that how many ovaries does a woman have?
Well, since I'm the host, I'm going to ask my fellow.
You have the woman, right?
The examiner doesn't answer questions here.
Yeah. Since you're white.
Fellow committee. Right, since I'm white. Who wants to carry on, please?
Please, answer your own question.
Well, in my mind, I'm assuming there's no fixed number.
What do you think?
I'm assuming
you're a woman, so you should know. Yeah, you should know. How many ovaries do you have?
I honestly don't know.
You?
I was thinking 2.
It's 2 actually.
Yeah. Wait, so every woman has 2?
Yeah, they have 2 ovaries. 2 fallopian tubes, 2 ovaries. Yeah. Remember?
That's what I was thinking. We have eggs and ovaries. E's and O's.
So that's the reason I asked this was because when you see polycystic, it means that they are in the ovaries, right? Now, with this happening, it causes hormonal imbalance. So the hormonal imbalances, there are 3 parts. For us to diagnose that you have PCOS, right? We used to use the Rotterdam criteria. We have an image of it. So if you have 2 out of the 3 points on the Rotterdam criteria, we diagnose that you have PCOS.
Please, what's PCOS?
PCOS also affects the menstrual cycle.
Yes, it does. So I'll come to that. So
I think let's take it back to Jason's question because what is PCOS and how do I know I have PCOS?
That's what I'm trying to say. That we have the Rotterdam criteria, which helps you identify whether you have it. So it's 3 points that you need to have. If you have 2 out of the 3, you have it. So when you say polycystic ovarian syndrome, it means that there are cysts of formation. So imagine you have a balloon and you have water in it. The way it looks, the structure it looks. So you have noticed, when we have an image, we'll show of it later. But the idea of it is that, number one, you should have hair growing, male pattern hair growth, which is due to hormonal imbalance. You have androgens. So you see, your hormones that you have, the female hormones that you have, we have it. The male hormones that we have, you also have it. But you have it in a certain amount, and we have it in a certain amount. Therefore, it shows how I physically appear to you and how you physically appear to me. Right? So these hormones are supposed to be the messengers. These chemicals, they go about, like the brain sends them this way and that way. Now, the problem is that when a woman has PCOS, she has an increase in androgens, which is the male pattern, male hormones.
That's why some of them tend to have beard.
Beard. So years ago, when a woman has beard, they say she's a wicked woman. That's why she has beard. She has beard.
I've seen some videos recently of women with like beards.
Yeah, that's PCOS right
there.
Always
the case?
Yeah, it's the case. It's called hirsutism. Hirsutism, like hair. So she's going like
But is that the same as hormonal imbalance, or it's part of it?
It's part of it. Okay. So it's one part of your hormone that is out of sync. Because of the PCOS, you get it? Which is
the male hormone in our body.
But yes. So then it's causing you. The other thing that also happens to you is that it's going to cause you to start. You heard of insulin, right? The idea of insulin is supposed to help you with like blood sugar in the amount of sugar in your blood, regulating and all that. Now with PCOS, you start getting something we call insulin resistance. So in the sense that insulin stops working, and then you have more sugar in your blood, concentration of it in your blood. Now your body, in a way to try to fight this, will think about, okay, why are we producing too much? There's too much of it everywhere, and you don't need so much of it. So I'm going to try and store some and get rid of some. So it gets rid of some through your urine. Your kidneys will try and get rid of some. Then we'll store some of your kidneys, your liver, as glycogen. We'll store some of your liver as glycogen for maybe you might need another time. Then the rest of it, we store it on your adipose tissue, which is your lower part of your stomach.
Then you start gaining weight.
You start gaining weight. So you are gaining weight your lower part. You're not gaining weight anywhere else, but only at the lower part. It's because there's too much sugar. Your body. So that's the Rotterdam criteria for those watching.
Okay, so for those watching,
so I've mentioned the cyst, right, as part of it. I've mentioned higher androgens, which is the hormones. Then the other part is irregular periods. So whether a person for 2-3 months no periods, or it will come heavy flow, or it won't come at all. So out of the 12 times you're supposed to have your period in a year, somebody can get only 7 or 5. Now the problem with this is it's not only just this. Most people come because they can't. She's pregnant. She's fertile. She's supposed to have a child, but she's not able to release the egg that will lead to fertilization because PCOS is occurring.
Does that mean that there is a presence of the hormonal imbalance? There's a presence of testosterone.
Exactly.
In
the male, yes. In the female, yes.
Right, because testosterone is a male
hormone, which is for building what?
Muscle,
exactly.
But estrogen is for the
female.
Estrogen is for female. Yeah.
So just little digressing, men too can have more.
We have it.
No, like more.
Yes. So a man having a lot of estrogen, the man will start to develop nipples, breasts. You get it? It starts behaving a feminine manner.
What's that?
The person's in tune with their femininity. They go, oh no,
Jason.
The voice changes, right?
What's that called?
Now, there's a drug that can also cause that. When you start using steroids, it can trigger that mechanism.
Oh, that's why they they become huge.
Yes.
It's gonna fall down, bro.
No, Doc, so, what's that called for the male? Because it can't be PCOS.
It can't be PCOS. I'll find that. I have to research and give you that. It's there, but it's not coming.
Yeah.
There's a word for it because you usually see it in people who are working out, like fitness. Those guys trying to build. They want to bulk up really fast.
Like elegant.
Oh.
Elegant was working out.
If you guys don't know him, very soon you see the word. When I became vexed.
So that with the Rotterdam criteria, if you get 2 out of the 3, then you have PCOS. You diagnose you have PCOS.
It's not a good thing.
It's not a good thing. It's not a good thing, right?
Okay.
Now, why is it affecting weight gain? It affects weight gain and also affects weight loss. Because when you are trying to lose weight, your body needs to be able to go and trigger the mechanism that will burn all this fat or this glycogen storage, this fat that is stored, your glucose that is stored as fat and all that. Now, your body is producing more. You're also working out. It's not working. So either we solve the problem of the PCOS, right? So you can do stuff like you can go on the diet, right? You can also do the exercise. But the exercise there's exercise specific for people who are on PCOS who try to lose weight.
Okay.
It's not just, so they do more of strength training, not cardio. because they want to trigger the muscles to start to draw in for a lot of the stuff for energy.
Okay.
You understand?
Yeah.
And also they do a lot of we call it I don't know how the gym guys might correct me, but short bursts. They do short bursts of exercise.
Yeah, we do short bursts, doc.
So they work out quickly within 30 seconds. So you can run for 30 seconds at very top speed and then slow down and rest.
Doc.
Or you can lift weights quickly.
Yeah, we do.
And then try to like.
Well, I've seen a lot of videos like that.
So they do it quickly and they stop. Like it's intermittent. In the same way we do the intermittent fasting, you do it and you stop.
Yeah.
Now, it's not about willpower for these women. They are trying to lose the weight, but for some reason, it also the hormonal imbalance causes a lot of like, I'm trying, nothing's working, it's not showing. So then all of a sudden you give up on it. So it's no fault of theirs. Now, if PCOS goes on for so long, it can lead to your person becoming diabetic.
Wow.
And hypertensive. Because when there's too much sugar in your blood, that's what's going to come. You're going to get diabetes.
Okay. So before we go a bit further into this, with this PCOS, when you are starting to see the signs, as you'd advise, go to the hospital, get it checked out. If it's not far developed, what can you do to make sure it doesn't get to the next point we're going to get to?
Yeah, so we can start. We can do something about the insulin. Okay. So we can, because you have insulin spikes, we can try to draw down the insulin, and because the testosterone is high, progesterone or estrogen is lower, we can also manage that and try to with medications, and also regular strength training, a lot of rest, so the body will process the energy storage. Now, this is very important because this continually can lead to you being infertile for a woman.
Yeah.
Do you understand how it works? In the sense that though it's not causing you any bleeding and not causing you any like pain and all this, ideally behind the scenes is giving you signs and symptoms.
Yeah. This is scary.
But is it because maybe you're not able to track your periods really well?
No, even if you're tracking your period, right, you can't tell me that within a space of 2 weeks or a week you're having your period twice.
Yeah.
And then for like 2-3 months you don't see anything. You know what, people freak out. Those who are sexually active, they freak out a lot over this. Right? Yeah. You see how I always tell people that the free period thing that people use to try and have unprotected sex is very dangerous in the sense that if you have a family history of PCOS, there's a chance that you have it.
Yes, so that's what I'm saying, that you'll not be able to tell when exactly you are free or when you are not free.
So the app will be going, the AI will be going crazy because that's even one, like the AI is wondering.
Oh.
Like, what's up with you? But let's not forget, sometimes stress of work and then medications, maybe you're treating malaria and something else, or your diet can make your period change the way it is. But for as long as you are doing that, you are healthy and everything's okay, you should have your period regularly.
Okay.
Doc, that leads me to find out, can PCOS be triggered by external factors like maybe contraceptives or like anything that the person has to take in?
There's a lot of research going into it, even the cause of it that we are not very sure about, but it's possible. There are environmental factors that can cause you to, because as I mentioned, there's also lineage. If somebody in your family has, there's a chance that you're going to get it. Right? And because in the past, most people gave birth early. By the time they got PCOS, it didn't show because the person is done, so it didn't really matter. So if you see a woman with beard and you have chest hair, please, like, your ignorance, I'm teaching you today. Be respectful about it.
I see these videos a lot. I don't know if you guys see these videos. These ladies with hair and they come.
I don't like to. The first time I saw it was in first year medical school when I was outside. We do these examinations. We are supposed to do the CGG and all these tests to make sure we are all healthy and all that. And then I was supposed to take the second batch in to do the test. So the ladies were changing and it's health, so nobody cares. And one of them had like a lot of like
chest hair.
Yeah, chest hair. And it freaked me out a bit. But after like reading, and I realized that okay, there's something she's dealing with. It's something that, so later on we even used to talk about it. Then she used to join us the male team to train when we go do our gym work, and which helped her in the long run, which helped her to overcome it. Right? Because you'll be gaining weight and you won't be, as always, women always complaining. They come to us and say, I'm not gaining weight in the right places.
Very interesting. Yeah, because we see these things and we think weight gain is just about eating food. Right?
Yeah,
you
so
eat more or you...
Now, if any woman wants to start her weight loss journey, she would have to find out if she has PCOS.
Exactly.
Before. Because that would affect the kind
result
of training and then the results and even the process, how to go about it.
Because somebody who has PCOS will be on medication to help with the weight loss. You and that might not be.
Oh, right.
Right. Team Music always advocating for women to get checked. People, even males, to get checked. Get yourself checked. It's the best thing you can do for yourself, knowing that, you know, for lack of a better sense of how to say something else, a woman's life on this earth, childbirth is part of it. Fertility is part of it. And male needs to provide and be. As part of it, you also need to be fertile. So men can make the mistake of sleeping around and doing all this rubbish. But in the end, the person who bears the grunt of the work is actually the woman. So if you're living in a society where a lot of the women don't know this is happening, which is leading them to have diabetes and leading to complications and all these things, it means the number of people that are going to be fertile, be able to productive in this society to help the next generation is lowering. The number is going down.
I also wanted to know, or would you?
Because you were talking about the hairs and all that. At what age does someone get PCOS? Because way back in JHS, I knew someone who had like DSBS and all that. So are you trying to tell me that in JHS she had PCOS?
As long as a period has started.
Okay. Makes sense.
You dissolve the ovaries. That's why I started with ovaries. As long as you have ovaries, you have a risk of getting PCOS.
Okay.
So if you don't have ovaries, like if we had a case recently on the discussing, and the person kept saying we have a male patient, blah blah, we have a female patient, blah 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 blah, blah, and the diagnosis, my other teammate said, then the diagnosis is prostate cancer
for a female.
You see how you just reacted, right?
Yeah,
because you are wondering how did you get prostate?
But the presence of the hormone in there.
No, it's not possible. A woman can never have a prostate.
No, I'm saying.
But in our new society, in our new dispensation, that case was real, in the sense that the female we were seeing was actually a male who has switched sides.
Oh, right.
This is not
right, you're confusing me.
I did not.
No, I
we
think I
were
got
as
it.
confused as he was.
No, I got it, but I just wanted, because when Tripp said maybe it's possible, I was like, okay.
No, I didn't get it.
So I didn't think about our brothers and sisters on the other side. I just thought about really, for real.
The brethren on the other side.
I just thought about. So you know how PCOS signifies the presence of a male hormone in a female, or like heightened. So I felt like maybe it was a misdiagnosis on the basis of the presence of that
testosterone, right?
But it could also be that says that somebody who developed both female and male genitalia could also have it.
Had to do away with one.
It's true.
So I was confused.
So there's like three scenarios in which a person could have it.
Yeah.
Right.
I mean, you just drew my attention to
so
the
other part,
to the alphabet community.
Yeah, because of that, now in healthcare we always have to ask. You have to also confirm. Like you have to confirm that.
The patrol, why a bemada?
No way.
Oh,
I wasn't expecting that.
But because the hormones to some women come with like base.
Oh.
Yeah, like and then some men also come. Men come with like very small voices, like male. Like it's like stop that. I'm like.
Bro. And if you're out there and you bully men who have softer voices, stop it.
Wait, but please, just on that also, does this thing have to do with the estrogen or the or sometimes are there like natural instances where no matter the testosterone you have a very low pitch?
No, female hormones has it's there are things that we have that is the female hormone that is helping us have it.
Okay,
you get it. When we talk about hair growth a lot, right? It's the male hormone that has it a lot, right? So if you're having, that's what we call it, male pattern hair growth.
Doc, you see, we are just naturally masculine. Like we just don't know, Doc. Like, anyways. So, Doc, before we also get to
the pink lips is feminine.
Yeah.
Hey, Doc. So before we get to the extremities of this PCOS and again this weight gain and stuff, menopause too and its effects, because I don't want us to miss that.
Yeah.
Menopause, please correct me if I'm wrong, has to do with age in women.
Yeah.
So does it mean that at a natural point in their life, PCOS will come into it because of the menopause, or that's not?
No.
Correct,
so when let's put menopause on this way. When you have menopause, estrogen levels fall. It drops. It drops drastically. Estrogen drops drastically. Now, estrogen is actually supposed to help you regulate where fat is stored. The estrogen in your body tells you, okay, you go here, underarm, you okay here, you there. Now, if it drops, it means that it's going to redistribute straight to your belly, because that's the largest surface area it has.
Okay.
You see, when you talk about expansion, right? Skin expansion and distension, right? The abdomen has the ability to distend more than most parts of your more elastic than most parts of your body. That's why a woman can be pregnant and you.
Okay. So you said something there. I don't want to miss this. So that's why older women might gain weight in their bellies.
Exactly. Because of estrogen levels.
That means the estrogen is going down.
So it means it has nothing to do with eating fufu very late.
No. It's you see, your estrogen level is down. Your insulin levels are all over the place, and you are trying to like the mechanism that is supposed to regulate all these things is out of sync. Yet you are feeding it more
starch.
Yeah, just giving more starch, like giving more. Now the person who's supposed to be doing the work. Let's say there was 100 people on the shift. Now there's only 5 people. They will do the work alright, but you still have excess lying around, and to get to a point,
Backlog.
you know those times what we used to do when you see that your house is like you get some and the ladies coming, but sometimes your parents are coming around, you just dump the clothes, books under the bed, you know, try to that's what's happening.
Doc, so let me ask this question for the girlies, right? Does it mean when you work out to like work on your glute muscle, you can expand them so that whatever fat needs to be deposited goes back there?
No, when you work on your glute muscles, you're actually not expanding, you are tightening it.
Oh, right.
Oh, so the gluteus maximus gets tighter.
Firmer, sorry, for like firmer.
But
it's the same thing with muscle. When we do it, it's not because it's not expanding, it's actually getting firmer.
Yeah.
So doesn't.
But if you want it to bulk up, that's what the word is, bulk up. When you want to bulk up, you need to increase creatinine, which is in protein.
Okay.
So that's why people then they have shortcuts to protein, like whey protein, shortcuts.
So there's nothing wrong with those things.
There's nothing wrong with it. So if you are doing protein, if you are doing protein for bulk up, right? If you are doing a protein, for example, if you want to lose weight, right? In our part of the world, if you could transition from carbohydrate to protein, it will help you a lot.
Yeah.
If you can, it will, but it's expensive lifestyle.
I have one question and one submission. So that is why if someone takes whey protein and they don't work out,
it becomes flabby.
They become flabby. Yes, because you're supposed to work. It's supposed to give you
a bulk, muscle bulk.
And then when you work it out, it becomes
tighter and firmer.
So
it pushes away your fat. The fat, like it squeezes against the fat and pushes it away and bends it out.
I have a question for the girlies.
Go on.
Yeah. So it's also I wanted to find out. So menopause is not age specific. It actually has to do with the presence of estrogen, right? Because I understand that there are women who are as young as 30 and 25 who are experiencing menopause.
You remember we spoke about it some time ago that if you start your period early, because the eggs that you are producing have a finite number.
Oh my
God!
I
know people don't say I'm sorry, but like
wow, that just threw me off.
If you start your period early, right, and let's say you have 70 eggs, it means that if it's earlier, you're going to hit menopause faster.
So we have 70 periods.
No. Example. If you have, I'm trying to say that if you start early, you're going to hit menopause faster. If you start late, you're going to hit menopause later.
Okay. So it can be a 30
because the number of eggs that I have, because the worst thing about this scenario, or the bad, I don't know how to say it in a nicer way, is that your body will produce all these eggs, right, at quality level, and your body will choose the best out of them, and the rest of them is reabsorbed or goes to waste.
So the earlier ones are the strongest ones.
Exactly.
Wow. Okay, so Doc, we have a picture.
So with PCOS, you see, with the normal ovary, you have your it starts from your corpus luteum, it matures to your primary follicle, it moves like a cycle, right? You're going mature follicle, primary follicle, then the cycle continues, and then it leaves there, right? Okay. Now in this side, we have a lot of immature follicles. They are not developing from there to mature.
Okay.
So they're staying there, and that's what causes the polycystic system.
Wow, that's scary.
Right.
So, Doc, is there anything to add? Because I want to ask about, again, as I was saying, the extremities of this. You know, when the PCOS and the
extremities of it. The extremities of this is infertility, diabetes, hypertension. Yeah, because this. When you talk about this, you have to go all the way to ovarian cyst. When you jump from ovarian cyst, you have to go to fibroids. You see, when you talk about women's problems, right, concerning childbirth, So sometimes I get it why they are demanding. Sometimes I get why they demanding. Some to take it too far.
Does this lead to all those things you just mentioned, please?
Yes.
The same.
No, not the same.
Okay,
But I'm trying to I'm talking about conditions that when it comes to fertility for a woman, menstruation, all these things, it's all affected. Well, as soon as menstruation stops, you have a problem. Either you are pregnant or you are becoming infertile.
Okay.
So that's like basically.
Or you have become menopause. You get it how?
Operation. The OS of a woman's anatomy.
Operating system
of a woman's anatomy. It's crazy that it's PCOS because the OS of a PC. I'm sorry.
God.
I didn't think of it that way.
No, like my brain was just like it was just like wow.
No, but so you see, we can advise if in this situation, women should be able to give birth early, and then get their body back and go back to school and whatever career they want to chase. And with the right support system, they should be able to do that, right? But unfortunately, society is different now that they have to chase career first.
Men make us want to work harder because
we
are demanding.
Yeah, because now a lot of men are going for career women. Somebody can have a conversation, educated conversation.
Because if someone working, I'm
also advocating against the men who are also, whether intentionally or intentionally, we have a lot of baby mamas these days. It's now like
Doc, please let me just say something. That one day I don't agree. I believe in one wife and your babies.
Yes.
That's just a person.
Yeah.
But I know people who are in different
like 3-4 years.
That's cool. I don't believe in the multiple baby mama thing. Okay. What I wanted to ask my darling, I want to know, as doctors, right, how you guys deal with patients and women who go through these problems and the fact that these societal constructs are also there. Because we sit here and we say it's best to have babies early for women, and that's just the scientific fact.
But yes,
we go online.
Social aspect of it is different.
When you're 35, when you're 40, you can have babies because maybe a billionaire somewhere had babies at 40 and 45.
Yeah,
we see these things. The table there. So, as a professional, how do you advise women on these topics? I just want to know this from a personal perspective because she said something very interesting, right? There are men who now want career women, but there are also men who go online and say, oh, if you tell a woman that she should be a housewife, I'll take care of her. You are going against the norms of what is expected of society today. But having a baby and carrying a baby around is not an easy thing.
Let me jump in from there, right? It takes 9 months for her to conceive and everything, right? And then from beginning to end, right?
Yes, please
now,
end on this.
Yeah, that's 1 whole year of a woman's life gone, right? 1 whole year of her waiting to deliver, right? From there, she's breastfeeding, she's nurturing this child. That's another year. By the time the child will be a bit independent and do other things, that's 3 years, 4 years. What is she doing between there? She's managing the home, she's going to school, she's doing all these things in that same time frame. So, yeah, big ups to women. Superpower, like, I don't know what would have done without them. Annoying as they are, but yeah, we still need them.
On that note,
Mom, I'm sorry.
Do you want to add anything before we go?
Before I go, any person who is listening to any woman or you know somebody is living with these conditions and you see someone say, please see your physician.
Okay.
The earlier we see this, the earlier we treat and we help you out. And also those who are trying to lose weight, be conscious about it, be healthy about it, and keep it up. I know it's difficult, but we are here with you. And 3 Music Tuesdays. We are here with you.
We are
here with you.
We are here.
I'm just kidding. It's just a joke. Like,
so we do have to sign off. But yeah, I do agree with what Doc said. I mean, a woman's body goes through things me as a man cannot imagine. That's just the fact. That's just life. And as men too, if we don't make things of ourselves, we're not allowed to enter certain doors in certain space. So men and women are not the same. That's just another fact. So let's all respect each other. Last. What do you want to say before we sign?
I mean, last. Like, shouts to all my women. Shouts to my mom, my sisters.
Or if you go house,
please, it's someone's birthday, very special person, actor William Chambers, on YOLO. Yes, I've forgotten his surname, but really happy birthday to you this morning. Hopefully you're having an amazing day.